call on the lightning round. You mentioned small dollar stock. Sometimes it's kind of interesting. It's the reason why I tell you to do this, to speculate on tiny digit stocks with small market caps, is because of what you're about to hear. I'm talking about Sangamo BioSciences, SGMO for all you home gamers. This is a company that's at the forefront of DNA-based medicine. They're working on therapies that can treat diseases by physically changing your DNA. Your DNA, including genetic therapy for HIV that's in phase 2 clinical trials that could potentially be a functional cure. Stock popped $3.35 or 17% today on the news that the first clinical study of Sangamo's genome editing technology in humans was just published in the New England Journal of Medicine, which is a major validation of the platform. And the company also presented some positive HIV data at a major conference today. Now, I've always believed Sangamo is a game changer, and they're more than just a one-trick pony. That companies also develop treatments for blood disorders like hemophilia and sickle cell anemia, as well as a group of rare orphan diseases known as lysosomal storage disease. That said, the stock's already given me 145% gain since I got behind it 11 months ago. It's speculative stock, no doubt about it. Ring the register on at least half of your position if you bought it because of me. Plus, the stock has become controversial as late. Some critics claim that the current standard of care for HIV, a cocktail of drugs from Gilead, is already pretty darn effective. So let's take a closer look with Edward Lanphier. He's the founder, president, and CEO of Sangamo BioSciences. Learn more about his company and its prospects. Mr. Lanphier, welcome to Mad Money.
Good afternoon, Jim. How are you?
All right, sir. Thank you. First, I want to just get everyone, so they're not too excited. The idea is that you have a platform that can be applied to a lot of different diseases, including potentially HIV. It's not that you've got an HIV cure and people should get excited about it.
Well, I think it's both, Jim, but you're absolutely right. What Sangamo is developing is a genome editing platform. We have the ability to target any DNA sequence we want and physically and permanently engineer that gene. And the goal is to focus that on genes where either disrupting the expression of that gene, like we're doing in the HIV program, has significant therapeutic value, or physically repairing a gene where there's a mistake, like in hemophilia or in sickle cell disease, as you mentioned. So what we're really trying to do is at the DNA level, not just treat the disease, but physically change the DNA in a way that it can cure the disease.
Okay, on the cure for HIV, you're in phase 2, so it's not necessarily that that people who are right now taking a cocktail that is established are about to jump to your genome editing process.
You're right, Jim. We're in phase 2 clinical trials, but ultimately, if we're successful, that's exactly the goal. The goal is to modify an HIV patient's immune system in a way that his own cells, or that AIDS patient's own cells, can track down the virus and destroy the virus so they don't have to be on any of those cocktails for the rest of their lives.
Now, hemophilia, a giant disease. I know you've got a partner here. How do you interact with your partner to make it so that you don't run out of money by the time you get to the promised land?
Right. So we're working with Shire in the area of hemophilia, and Shire is a great partner. Specifically in that collaboration, they fund 100% of all of the work. But Sangamo is actually very well financed. We started this year with about $130 million in cash, and because of those partnerships and our new collaboration with Biogen in the area of sickle cell disease, we're actually guiding to ending the year cash flow positive with $135 million in cash. So we're in a strong financial position. We've partnered some of our programs, and we're taking forward several of the programs on our own.
But you're in a competitive business, though. I mean, I was reading an article in the New York Times talking about another company that says they have a Dr. Gersbach at Duke saying that there's a way that zinc fingers, which is your way, is not as good as another system called CRISPR, C-R-I-S-P-R. Says that yours may take months or years. CRISPR just takes days to weeks. I mean, is it really cut and dried like that?
No, it's not. But you can imagine that the area, if you can really engineer the human genome and generate not treatments but cures, this is an exciting space, and there's a lot of interest in it. Our technology is the only technology that's been in humans. We've treated over 70 patients in the HIV space. I think CRISPRs are fantastic, and I think they're going to be an incredibly powerful tool because of what you just said. They're so easily engineered. They're going to be a powerful tool for research. But the key to human therapeutics is specificity, the ability to target exactly the gene you want and only that gene. And that's where zinc finger nucleases have the complete monopoly on that kind of outcome.
Okay, we had TMO on, Thermo Fisher, Thermo Scientific.
Yes,
people might know
yeah.
it. And you know what they were telling me was that you can't see any of this without a right. I couldn't see any of it. Naked eye, nothing. Only really powerful kind of spectrometers can actually see what you're doing. Is that right?
Well, one of the real tools we use, and they're a leader in this space, is whole genome sequencing. And that's one of the reasons I can talk about exquisite specificity. So when we modify a cell, let's take the program we're doing with Biogen in the area of sickle cell. When we go in and modify the one gene in a stem cell, we can do a whole genome sequence of that stem cell and show that it's only that single site that's being modified. So you're right, none of us can see this work, but the instrumentation like those groups are incredibly important for what we do.
Is there any disease that with DNA, like defective DNA, so to speak, that you couldn't, with this platform, solve someday?
Well, ultimately, Jim, and I don't want to go too far off the reservation here, where we're focused now is on clear so-called monogenic diseases, where there's an unambiguous correlation between the gene and the mistake in the gene and the disease, like hemophilia, like sickle cell, like lysosomal storage diseases. There's an unequivalent correlation between the mistake in the gene and the disease. And so that's really the low-hanging fruit for us. Ultimately, the technology is completely agnostic to the gene. So if we can deliver it to the cell, if we can deliver it to the organ for the right period of time, there's really no gene that this technology can't approach. And I think that's why there's such broad-based enthusiasm. The HIV program that you referenced in the New England Journal paper, the data we presented at CROI today, I think establishes the power and the ability to move this forward from a regulatory perspective. But the partnerships that we have and the other programs you've discussed really, I think, highlight the generality of this, and it's very exciting.
Right. That's why I want to put the generality. That's the right term, because when you read the New York Times article, you say, wow, they may have a cure for everything. No, what you do is that you have a great platform that can be used widely, that I think a lot of drug companies they have to rely on your platform. No one else has this gene editing that you have. I mean, that's what's special about Sangamo.
I think that's absolutely true. And going back to, as a company, we're very well financed, and we're in a great position to take this technology forward over the next 12, 24, 36 months. We expect to have 4 new programs in the clinic this time next year, 4 more programs in the clinic the year after that. This is really what in the industry we'd call an IND engine. And we're able to very efficiently and systematically develop targeted genome editing therapeutics for genes that really have a clear, unequivalent correlation with that disease.
Well, it's both very exciting and very practical, and I'm glad you shared it with our Mad Money viewers. Thank you so much, sir, for coming on our show.
Jim, thanks for having me today.
Absolutely. Okay, look, this is that's Edward Lanphier. It's the president and CEO of Sangamo BioSciences. Yes, we identified this a long time ago. If you hit it, ring the register on some. But as you can hear, it's a very exciting long-term platform that can solve a lot of diseases. Stay with Cramer.